Hi, based on the request received today, I'm going to solve paracetamol overdose part A question. To begin with, we will be underlining the important words for me. In text A, if you see the bold words, special warnings and precautions. So, the text A is about warnings and precautions, interaction with other medicinal products and other forms of interaction. So, I'll just mark up my word as other forms of interaction. So part A, it goes with warnings and precautions and other forms of interaction. So text B, it is about procedure for acute single overdose. So this is all about the procedures, and if I could see the important words, something like single overdose and 4 hours, 4 to 8 hours. So there is some time. So I need to mark it, and then patient needs treatment with acetylene. So I will mark this also as my point. And then if you go for text C, it's a graph. So any tabular column or graph, if you have, just check the topics or something mentioned in X and Y axis, try to mark it up. So here it is plasma paracetamol concentration, so something related to mg liter, with time and hours I will refer text C. Here it is mentioned like paracetamol poisoning, emergency treatment, this will be my point. And text D, it is all about clinical assessment and history. So my overall points for text A, it is warnings and precautions, other forms of interactions. Text B, procedure, I have taken something like which is really like main topic, single overdose, hours, as well as needs treatment or not. Text C, it is emergency treatment, and I have taken x-axis and y-axis, whatever it is mentioned there, as my point. And text D, clinical assessment and history. Meanwhile, there is something given like bold letters, normal treatment line within 10 to 12 hours, high risk treatment line. So something mentioned in bold letters, that also to be considered as your points. Now, solving the paper. Okay, question 1 to 7, try to match up with the keywords what you have marked. If I could see here, it is given like various symptoms, this is my point. And the patients who have taken means already consumed, so it is talking about history is in D. So my answer is D. Precise levels of paracetamol in the blood which require urgent intervention, urgent, so emergency, right? So it should be C. Steps to be taken is procedure, so it should be B. Whether paracetamol overdose was intentional, so it is asked as a question, was intentional, so it should be assessment should be D, clinical assessment, right? The number of products containing products, if you remember, we had like forms of products, or I think it is interaction with other medicinal products and other forms of interaction, so it is A. Next, what to do is, again they are asking the steps to follow. So procedure, if no details available about the time, I think 4 hours, 12 hours, something they have mentioned, so it's B. Dealing with paracetamol overdose patients who have not received adequate nutrition. Now nutrition I haven't seen. Dealing with this treatment we have seen it in C. Just to confirm whether nutrition is mentioned or not, I'm just checking in text C, scanning whether it is mentioned or not. Yeah, here the word as malnourished, so I'm going for C. Okay, next, question 8 to 13. If paracetamol, if is conditional, okay, if paracetamol is used as a long term painkiller, what symptom may get worse? So may get worse is something like precautions or warning. They are asking like what is a symptom. So I need to refer A, and what symptom when it is used as long term. So when I go for A, is there mentioned as long term? Yes, it's here. And when you are using it for long term, symptom here they mention as headache, whatever it is written there, use the same word. So headache. It may be dangerous to administer paracetamol to a patient with which viral condition. Dangerous, again it is warning, so I will be going for A. What I need to check, which viral condition, so I will be going for A and check the viral condition. Just scan it, don't read it, scan it. Okay, here I see hepatitis C. Okay, next, what condition may develop in an overdose patient who presents with jaundice? So who presents with jaundice is history, right? So I have to go D. What condition? They're asking about the condition. Okay, so when I go for D, check for jaundice. Yes, jaundice is here. And is there any condition that develops, can progress to acute liver failure? Okay, can progress to acute liver failure. Here when they say acute liver failure, you have the complete word as well as abbreviation, so whatever you like, please write it. So I'm writing like ALF. Okay, now 11th question, what condition may develop on the third day after an overdose? It is after an overdose, so it is again assessment. So after an overdose, and it is for third day. Okay, again they are asking like what condition, so I'll go to assessment and I will check like, is there anything given like third day? Yes, day 3 they have mentioned, and the condition is renal failure. Okay, what drug can be administered orally within 10 to 12 hours? If you remember, within 10 to 12 hours is emergency, and we have also seen this within 10 to 12 hours, which is bold. Now they are asking like alternative to. So is there any word alternative, or they have mentioned something related to that? Just check. Here, if acetylcysteine cannot be used means if not used, what other way we can use? With methionine by mouth, so I will be writing that as my answer. What treatment can be used if a single overdose has acquired single overdose? So single overdose, it's B. Has acquired less than an hour ago. So if I say like single overdose is in B, then I have to check for an hour, less than an hour, right? So I'll go for B. Check, is there anything given as less than an hour? Yes, here it is. Okay, and what should be given? Consider activated charcoal. So I will be writing like, okay, the next one, if a patient has taken, if is again conditional, okay, has taken metoclopramide alongside with, so alongside with paracetamol, alongside is the word for interaction, so interaction is in A, right? This may affect DAS of the paracetamol, may affect, so I have to go for the drug. Here it is, may increase what? Speed of absorption. So I have to write here as okay. After 24 hours, an overdose patient may present with. So it is after 24 hours means it is like assessment you are trying to observe. May present with pain. So they are asking like where it is in the, okay, some parts maybe. So I have to check in the assessment. First 24 hours. Okay, here it is. They have mentioned here, I could see right upper quadrant pain. So they are talking about the pain, right? So I have to take only the word as right upper quadrant. Okay. Now again, after 24 hours, here it is first 24 hours after overdosing, patient may only have such symptoms. So again we have to refer D as what? Okay. Any symptoms they have mentioned first 24 hours or just have nausea and vomiting. Okay. So it is mentioned as nausea, sorry, and vomiting. Okay. Now, Handsolved should be administered to patient with a paracetamol level above high risk treatment line. If you see this is bold word which we saw in C. Who are taking any type of what? Okay. So here it is mentioned as medication. So we are looking for some medication, right? Okay, high risk treatment line is here. So here the drug they mentioned as patients on enzyme inducing drugs or who are malnourished should be treated with acetylcysteine. So we are looking for medication, that is drug. So here it is enzyme inducing. So write, okay, a non-high risk patient should be treated with, for paracetamol poisoning. So this is about C. If their paracetamol level is above dash mg per liter 8 hours after overdose. So when they say non-high risk patient, in the graph it is only two lines, high risk treatment line and normal treatment line. So when they say like non-high risk patient, I should go for normal treatment line. And they are asking like for 8 hours what is the mg per liter. So when I see here it is 8 hours, below it is mentioned as time and hours, right? So till the normal treatment line I have to go straight, and this matches with 100 mg per liter. So I will write 100. Okay. High risk patient. So next is high risk patient. The above one is non-high risk. A high risk patient who overdosed dash hours ago should be given. Now it's reverse. They are asking like for 25 mg per liter, how the hours you need to check for high risk patient. So they are talking about 25. I could see 20 and 30. So in the middle I have to check, right? So I have to touch high treatment line. Yes, I touched, and this goes to 12 hours. So I will write here as 12. If a patient does not require further acetylcysteine, they should be given treatment categorized as, they are talking about categorization, it is in B, and they are asking like does not require. If you remember, we have marked something like patient needs treatment. Okay. Now patient needs treatment with acetylcysteine. They are telling here as question does not require, right? So does not require means I should go with no. No is supportive treatment only. So here I have to write supportive treatment. Hope you understood.